Hi, my name is Oliva Jimenez. I'm a third-year medical student. May I have your name and your date of birth, please?
Jonathan Lee, and it's October 6th.
Okay. Do you prefer Mr. Lee or
Jonathan's fine.
Jonathan's fine? Okay, Jonathan. So what brings you in today?
I'm I've been really oversleeping a lot lately, but I'm always tired,
Okay.
and I'm just doesn't feel normal.
Okay. When you say oversleeping, how many hours about do you think?
Well, sometimes about half the day.
Half of the day.
Yeah, I nod off in the evening a lot and wake up in the middle of the night and go to bed, sleep the rest of the night.
Okay. And when did this start?
I guess it's been about 2 months.
About 2 months.
Mm-hmm.
How much were you sleeping before? So about 2 months ago, how much were you
It's
sleeping?
normal, what, 7 or 8 hours, I guess.
7 or 8 hours? Okay. And you say you've been sleeping about half the day, but you still wake up tired.
Always tired. I'm always tired. I'm tired right now.
Okay. Have there been any recent changes to your daily activity? So something that you used to do that you don't do anymore, or something you've added on?
Well, I guess I used to go to the gym regularly,
Okay.
and I haven't been. It's too exhausting, really. I mean,
Yeah.
I can't even do a treadmill for 20 minutes without just feeling like I want to sit down and just
Yeah.
melt.
I'm sorry to hear that, Jonathan. So you used to go to the gym pretty regularly? Like
Yeah.
how often would you say?
Oh, probably about 3-4 times a week at least, I guess.
Okay. And like the first day maybe that you've noticed you were tired, is that about when you stopped, or during the 2 months is when you stopped going?
It was about 2 months, yeah.
Okay. How about any changes to your diet recently?
That's I'm not eating as well as I used to.
Mm-hmm.
I
That's
think.
okay. I don't either.
Well, I've put on 10 pounds lately.
Okay.
At least, yeah, about
Okay.
that.
So along with the sleep changes, you've noticed some weight gain.
Yeah.
Okay. Um, anything you've noticed other than being tired that is happening, like with you? Any other symptoms that you've noticed?
Well, I feel like I'm sad a lot. I just
Okay.
don't feel much like doing anything.
Okay. The sadness that you feel, describe it to me. What is that?
I'm just blue. I mean,
Blue?
uh, the reason I fall asleep in the evening is because usually I'm just sitting watching TV all evening, and I just nod off, and I just it's hard to get myself motivated
Okay.
to just get. I keep sit there thinking I should be doing something,
Yeah.
an activity or something. I'm thinking I should get up and do that, but I don't. I don't do the laundry or something, and I
Okay.
keep thinking I should be doing that now, and then I sit there, and a while later I think, well, I need to get up there. And
Okay. Jonathan, do you live alone?
yeah.
You do. Okay. Are you retired, or do you have
No, I work at Kaiser.
Okay, you work at Kaiser. What do
Yeah,
you do?
I'm a medical assistant.
Okay. And this tiredness that you feel, this sadness, has it been interfering a lot with your job lately?
Yeah, I think so.
Yeah. Okay. Have you felt that there are times where you need to call off of work or call in sick because of how you feel?
Well, I try not to do that.
Okay.
um, no, I don't think I've called in sick.
Okay. Okay. So it's not interfering enough with your job for you to have to do that. Is that what it sounds like? Is that correct?
It's frowned upon. Let's put it
Okay.
that way. So
Okay.
I don't.
So you feel like you don't have the opportunity to be able
I
to do
feel like
that?
it's not a good example.
Okay. Okay. We're going to shift a little bit, and I'm going to ask you a couple of questions on your medical history, okay? Is that okay, Jonathan?
Yeah.
Okay. Okay, so I'm presenting today Jonathan Lee, a 50-year-old male with a history of asthma, who came in with a chief concern of excessive non-restful sleep. So he said that he's been having a lot of hours of sleep, about half the day, but when he wakes up, he doesn't feel rested. He says that this started about 2 months ago. And during the interview, when I asked him about this, I asked him if there were any events that had recently happened around the same time. And he said that around this time, he ended his relationship with his with his girlfriend of 5 years. I asked him, he denies any other medications that he's taken at this time other than albuterol for his asthma. And he said his asthma was well controlled. He denies any other prescribed medications or any over-the-counter medications, any herbal supplements or vitamins. I did forget to ask him about drug use, so I can ask him after that. He also said, when I asked him about his family history, that he remembers his mother feeling similar to this, described her as moody, as sad all of the time, never really showing any joy. So there's that. And so during the interview, Jonathan did look sad. He looked apathetic. He described feeling hopeless, feeling what's the point, were his exact words. And everything else, his vitals, his other regular medical stuff was fine. He was really just concerned with his lack of sleep. So during the interview, I asked him about his home life. He says he lives alone. I did neglect to ask about any previous psychoses, if he's had any, if he was having any other suicidal ideation or any other thoughts other than the feelings of hopelessness. So that is something I will correct when I go back in with him. And those were pretty much the things that I asked him about. It sounds to me like he is depressed. I would want to give him a referral for a therapist, somebody that he'll see regularly, and then further evaluation for what sounds like depression to me might be needed. I'm not sure what kinds of medications we could start him out on, but that is my assessment of Jonathan.